During this global pandemic and era of social distancing, I've been doing my interviews from home. This is where I spoke with Jennifer, who has led health studies in the United States, China, and several other countries in the last 20 years. She was speaking at a conference in Beijing shortly after the coronavirus was discovered in China.
January, I was in Beijing from January 9th to 14th, I think. Last day of the conference, I was at my time, I talked about the Chinese scientists published the genomic for this novel coronavirus. So I was using that as an example that the global collaboration will be helpful for any advancement of pandemic preparedness. But of course, at that time, we never thought about a pandemic. We thought, this is a new virus, and maybe it's a local outbreak. And we didn't even know this would be COVID-19. Certainly the name was not there. It was a cluster of pneumonia with new virus. But that was a start, actually.
Yeah. And when you think about the start, I remember Wuhan, the lockdown, that quarantine, and I remember so many people here saying, oh, that could never happen in the United States. Millions of people locked down, not being allowed to move. And of course, hindsight's 2020. But talk to us about that. Was that an effective means to try and at least slow the spread? What are your thoughts on that?
Well, as an epidemiologist and public health professional, I think my view is certainly leaning towards public health control. I wish, the world is as simple as just control the virus, contain the virus, because I think we, over so many years of experience, we know how to contain a virus of respiratory symptoms. But we always have to balance that with economy and balance that with social life. So anything that we do as public health professionals, we have to keep in mind there's a price to pay. So I do think that Wuhan lockdown is probably necessary now looking back, just because of timing. That's right before the Chinese New Year, and Wuhan is a very densely populated area and with many very critical, important industries in Wuhan. So it can be easily spread to other cities and just like what we have seen in India, in the United States, that people can bring that virus to many parts of the country. And, whereas the healthcare system is not so strong, it can cause a lot more deaths. So I think the lockdown at the time, I think it's a sacrifice of Wuhan citizens and many people there because they experienced a long lockdown, and especially in the very beginning, there's a shortage of medical capacity, so people panicked, right? So I think it's a sacrifice of their mental health and also a lot of social life. But in exchange that the virus wasn't really spread to other cities as it could be. So I think it's necessary. It saved some time for other cities to build up the testing and tracing and treatment. And it saved the world some time. But unfortunately, not every country has used that time opportunity to prepare. But I still think, it's a lot of sacrifice for the people in Wuhan at the time.
Jennifer is a senior researcher and China policy expert at the RAND Corporation, a nonprofit global policy think tank with offices around the world, including in Washington, D.C. Her research has centered on infectious disease prevention and global health governance. It's so interesting. China dealt with SARS in 2002. We haven't seen any known transmission since 2004. What do you think China learned about that pandemic that prepared them for this one? And talk to us about the relationship between the United States and China then versus now.
Yeah, it's also very different. Even though SARS in 2002 actually appeared in southern China almost about the same time. It was started in November, and it's not until February at that time that the Chinese government announced there's a cluster of pneumonia, and it was not until April and May when the genomic information was published by US and Canadian scientists at the time. So that was 18 years ago. So what we see this time is that there's certainly a much shorter time period, which I attribute to the success to the scientists and the technology that in genomic that we could shorten that confusion and get to the no, this is a new virus, and this is the genomic information from probably 5 months to about 30 days. So that's a successful story, and it has to rely on the development between SARS and COVID-19, and I would say that I have to thank to the US CDC, who really went into China right after SARS. At the time, the government really signed several agreements with Chinese government, very high-level agreements to build China's surveillance system and the lab technology. And from China's side, they looked at several different models of public health systems, and they chose U.S. System because they like what U.S. has done on epidemiology and lab technology. So that's a very conscious choice that they chose U.S. CDC as a partner. And ever since then, so we see very good wills from both sides at the time. So ever since then, U.S. and China CDC pretty much has been side by side through all these different small or large outbreaks. We're talking about H7N9, we're talking about H5N9 avian flu, and in Ebola 2014, the U.S. CDC and China, the largest humanitarian group, went to the West Africa, and they worked on the ground. They just side by side on that, and through that process, China really built up its capacity. So we see that from 2003, they didn't even have a large national reporting system on SARS. That was the first time. Until the time 2012, 2013, H7N9, China can already detected that new virus through their surveillance system. And that was the first time they also built a vaccine for H7N9, all in China. So I think China has put in a lot of investment, but there's also a lot of international collaborations and technology transfer during that time that built that good surveillance system. So I think China has a lot to thank for U.S. CDC for their collaborations, and the world has to thank China for building that capacity to understand this new virus.
It's so interesting, though, too, how deceptive it is.
Yes.
I've interviewed a doctor who told me one of his patients seemed to be great, went to the bathroom, never emerged from the bathroom, went in there and died. I've talked to an epidemiologist who talked about a patient in China signing discharge papers, and then suddenly, boom, this spiral. And that's the thing that's also kind of crazy about it too, right?
Yeah, so it's just we don't quite understand we're just beginning to understand, I would say, how virus affecting the health. And often, if they don't attack the lung first, then it's much less likely to show symptoms. So it could be a fever, and then just about the time people think, okay, I'm over that fever and headache, and now I'm okay. But then the virus is continuing to attack their heart, kidney, and brain. So that's the part that can be a sort of silent killer if we don't look for these symptoms in maybe more subtle symptoms in other systems.
January is China's busiest travel season. It's the Lunar New Year celebration and most of China is on the move. In 2020, the outbreak of what would become known as COVID-19 suspended travel for millions and sent a city into lockdown.
Given that time in January, what were the questions you were asking as this was just blossoming? What were you pondering? And how have those questions changed given the time that we've seen this kind of spread as remarkably as it has?
Right. So back in January, we thought it would be a new novel virus, maybe similar to H7N9, maybe similar to H1N1. Those are the only reference we have at the time. In the last 10 years, there are several new flu virus. Those are the most common ones. And we have seen that H1N1 caused some travel delays and travel screening. China was actually very successful with the H1N1, and we'll also call it swine flu. So they were very successful tracing the cases because it's would be an imported infection. So they had actually, I think they learned quite a lot from that in terms of traveler tracing of diseases. So we were never, H7N9 is a much more lethal, deadly virus. So there were predictions that maybe H1N9 would be the next big, cause of a pandemic, because it could be very scary. The case fatality rate is like 20%. It's really high, but it turned out we have been lucky in those cases because H1N1 was very easily transmitted, but it's not very severe. It doesn't cause lots of severe symptoms, which is when we look at H7N9, which is much more deadly, but it's not very easily transmitted. But then we have the COVID-19, which is a perfect combination. But even in January, we didn't know that the asymptomatic cases will play such an important role in the transmission of these diseases. So I think everyone was underestimated how quickly with the asymptomatic cases that this basically, I think in March, we're already receiving reports from all more than 200 countries in all 6 continents. So that's what we really haven't thought about at the time, and even with all the travel bans. So this shows how limited we know about the new emerging diseases. We really cannot have that complacency to think that we know everything about infectious diseases.
It's so interesting bringing up the asymptomatic piece of it, because you think about the super spreader event at the White House, and you think about all these people there without masks who are feeling great, but that's when you can be shedding the most virus, not even have any idea that you are, and it can just spread so wildly. Have you ever seen anything quite like this? Because that piece, like you said, it's the perfect storm. It's all these, and that piece of it is really important, isn't it?
Right. Yes, I think asymptomatic cases is the trickiest part, one of the trickiest part of this new virus, just because it even make all these testing less effective, because testing, we know every testing kit, all testings can have missed the acute period of, if I just got a virus and within 2 days I may not have enough virus in me to test positive. So that's the reason for some of the false negative. And usually the very interesting thing about COVID is that the first week of infection, the virus doesn't cause a lot of mild symptoms at all. So even if it's mild symptom, back in the spring, it's very similar to the cold or flu that's very common in that season. So I think it's very easy to mix that with other diseases or mild diseases. But then the second week or the third week, a certain proportion of the population will have very severe symptoms that back then we didn't know either. Back then we thinking this is a pneumonia, so it's mostly affecting the lung. Only later on we realize it affects the immune system, affects the vascular system, it affects the neural system. So there's just so much we learned from this virus that I think we wish we knew more back then to save more lives. But certainly in terms of treatment and detection, we're definitely better off nowadays than before, but still.
In 1918, an outbreak of influenza became the most severe global pandemic in modern history. It infected an estimated 500 million people. That's about 1/3 of the world's population at that time. The number of global deaths was estimated to be at least 50 million.
Over 100 years ago, we saw so many people lose their lives. The last pandemic, it lasted about 2 years. So how long is this nightmare going to be with us? And will we be better positioned for the next time? And will there be a next time?
There will definitely be a next time. It depends on the time. It could be sooner, it could be later. But hopefully what we learned this time will help. But in terms of duration for this time, I think COVID will be here for a while, given that how deeply it's already into our community. So if we have a successful vaccine, maybe 1 year, 2 year, this will be over. If we need a longer time to issue or implement the vaccine, it may last longer. So in any case, it would not be gone suddenly, magically. It needs a lot of hard work, and people need to, again, a lot of sacrifice for people's life.
With vaccine rollouts around the globe, greater availability of treatments, and social changes, there's optimism that 2021 brings hope. We can look back at what we've learned and how that will inform our future.
So we've talked about how deadly and deceptive COVID-19 is. But one thing I'd like to talk to you about is the approaches, because I think, as you were saying in January, we had no idea where this was going or how bad it would be. And I think a lot of doctors were flying blind. At first it was just this rare pneumonia, and then it became what we know it as today. And I think approaches have changed. I remember talking, vitamin C, and then traditional Chinese medicine, and hydroxychloroquine, and ventilators. So have we learned a lot in terms of how we deal with it? As a result, are we going to see more people surviving it? Are the symptoms going to be milder? What are some of the things we're going to see as a result of just our advances in our understanding of it?
So I think we have learned a lot scientifically, policy, and prevention. So I think it's not limited to treatment, although treatment has been a golden area for in terms of knowledge. There are probably hundreds and thousands of publications published on COVID-19. Even back in March, we had a special service just to sort through the papers coming out every day day. But I think it's not limited to treatment. We also see that we know now that in terms of transmission, the touching surface is less transmissible compared to, say, aerosol or the airdrops. So we know that some of the intervention can last longer than more effective, like wearing mask, compared to lockdown, because we have seen the severe consequences on economy on lockdown. And we also know that mental health issues is so severe in this pandemic that not just limited to the healthcare workers or people who are infected with the COVID-19, but also because of the isolation and the intervention that many people have seen a severe, significant change of environment and behaviors, and that needs adjustments. But back to treatment, we do see the case fatality is much lower than back in the January in Wuhan or March in New York City. I think partly it's because of the healthcare system know a little bit better how to prepare for a surge of cases, and partly because of the our better understanding of the treatment sequence. So we have a better treatment pathway. We know when to use a ventilator, and we know when to use some of the medicine, not necessarily to be the most advanced, but often what we see is the medicine that were used in the past for blood clot or for the steroids. Those are actually quite commonly used and cheap, but never used in the respiratory diseases or flu like this. So we know better how to treat patients at what time and how to allocate the resources so that the hospitals can quickly scale up the capacity for COVID. So I think those are all the good experience and knowledge we gained.
So how would a Biden presidency change the approach to the coronavirus?
I just actually yesterday I read through Biden's COVID-19 strategy. I like it a lot. I think it hit all the right targets. It talked about increase the capacity on tracing and testing, and it talked about a vaccines distribution plan. It even talked about re-engage with WHO and engage with many other countries, including China, in terms of global health and pandemic preparedness. So I think these will be helpful. My only concern is that it might be a little bit too late, but I still think it's better than nothing, even when we have seen the virus already affecting so many people in this country and has been reported in many states and county. But I hope that I have this confidence in changing the dynamic.
We certainly could use it. Thank you so much. Really appreciate it.
Thank you. It's a great pleasure to be here.